for adulthood, among them correction of undescended testes and different types of hernia. Reporter Elizabeth Atieno now takes us as in a theatre at the Kenyatta National Hospital and now brings you the real experience of what happens during the hernia surgical procedure.
It is 2:30 p.m. at the Kenyatta National Hospital in Nairobi. Hundreds of patients, mostly mothers and their sons, have flooded the corridors of this facility as they seek to benefit from a 3-day annual hernia and undescended testis surgery, fully sponsored by the National Health Insurance Fund, NHIF. We head straight to the main theatre. The surgical crew is ready to perform a hernia surgery on the abdomen of this 4-year-old boy. The first 15 to 20 minutes are dedicated to ensuring the patient undergoes a safe surgery by making them feel comfortable before hooking them to their respective monitors.
So what happens when the patient is admitted to the hospital? We do some blood tests, we examine. If we need to do any images, we do. And then the patient is prepared, the guardian gives consent to come to theatre, and then the patient is brought to the theatre, they are received.
And then because when we operate the patients, we would have asked them to starve, we also ensure that we are giving them intravenous fluids so that that compensates for the period of starvation so that they are not dehydrated.
The surgeons here tell us they must ensure the patient does not experience any form of pain. Hence, he will be sedated, in this case, the use of a special gas since the patient is a minor, while for adults, injections of anesthetic drugs are used. Dr. Praxidis Okutoi is a pediatric anesthetist at the Kenyatta National Hospital.
So it's about loss of consciousness, maintenance of physiological function, maintenance of a pain-free situation, and reversal of the anesthetic state into normal state.
When it's all systems go, the surgery now begins. Dr. Caroline Mwende is one of the pediatric surgeons operating on this patient and now gives us a brief summary of what takes place on the operating table.
So when you're doing the hernia operation, depending on the site, whether it's the inguinal or the umbilical, the aim is to close the defect that is within the muscle. So we go in, we get the defect, we close it, and then that's the operation is done.
The risk of mortalities from elective hernia surgery is as low as 0.1 to 0.5%.
These cases, we see them quite often. What happens is that most of the time we get to operate of them as an elective case. An elective case means it's not an emergency. The patient just walks into the hospital at a specific period that we had already planned for. But when they complicate, they do come in as emergencies.
A hernia occurs when a piece of tissue swells through an area of the body due to a combination of pressure and an opening or weakness of a muscle. Types of hernias include those affecting the abdominal wall, thighs, intestines, umbilical cord, and surgical cuts.
After kitovu venye likatika, nikamrudisha hospitali Pumwani, wakaniambia maybe nimlete huku. So huku ndio sasa nikaanza clinic, ikaenda ikipungua but ikafika mahali kasemekana lazima ifanywe surgery. Ndio ikuwe sasa ipone kabisa.
Those with the condition are likely to experience pain in the affected area whenever they laugh or cough due to the pressure on the abdominal wall, causing abdominal pains and vomiting.
Akicheka kilio ilikuwa na furafura na ndio kitovu ilikuwa ni kama na pump kama ball. Ilikuwa na pump. So tukaona kitu yenyewe inaweza kuwa serious. Ndio sasa tukachukua hiyo jukumu.
Kitovu ndio inafura sometime, akilia inafura, akikuwa na njaa inafura. So the time alikuwa mkubwa, kitovu ukishikashika ilikuwa soft.
There exists complicated hernia like the incarcerated hernia, which occurs when protruding tissue can't be pushed back into place, causing constant pressure or discomfort on a person's body. The other dangerous type of hernia is the strangulated hernia, which is a medical emergency that emerges due to lack of blood supply in the bulging area.
So when you're getting this complication, it means the organ here, being the intestine, has gotten into the hernia and it has gotten stuck in there. So this is an emergency, and this one we have to work on immediately.
Hernia and undescended testes are congenital conditions which develop when the fetus is still in the womb. For the undescended testes, the condition is serious, especially if the patient is not treated on time.
The risks that can come about having this undescended include injury to the testes because it's not in the scrotum. You can also develop fertility problems later in life, and then there's also the risk of developing testicular cancer.
For now, people have been urged to avoid the congenital conditions by maintaining weight to avoid pressure on the abdominal wall. Those smoking are advised to quit. It is also recommended that we refrain from straining when lifting weights, especially for those who have gone through abdominal surgery. We are also advised to eat high-fiber diet and drink a lot of water to prevent constipation. More than 35 Kenyan children under the age of 13 years have since benefited from the 3-day free anal hernia surgery offered right here at the Kenyatta National Hospital. However, not all hope is lost for the over 70 registered children left, as the hospital seeks to reach out to as more Kenyans as possible so as to avert any future occurrences. Elizabeth Atieno, TV 47 from the Kenyatta National Hospital Main Theatre, Nairobi.